Distinguished future physicians, welcome to Stomp on Step 1, the only free video series that helps you study more efficiently by focusing on the highest yield material. I'm Brian McDaniel, and I will be your guide on this journey through papillomavirus, parvovirus, and adenovirus. If these topics seem a bit random, it's just because these are all the remaining DNA viruses that didn't warrant their own video. This is the 7th video in my playlist covering all of microbiology. We will start with HPV, which I gave a high yield rating of 4 on a scale from 0 to 10. It is a very common virus that is transmitted through direct contact. It is non-enveloped, naked, double-stranded DNA virus that lives in the keratinocytes of the skin and the mucous membranes. These infections are most often asymptomatic. However, a small percentage of infections lead to warts, aka verrucae, that usually present with a raised, round, rough cauliflower lesion. These lesions are formed by a benign epithelial proliferation of the basal keratinocytes. This should make sense since we covered in our cancer video that the term papilloma means a benign, outwardly projecting overgrowth with finger-like projections. Warts usually don't cause pain, bleeding, or itching. Here's the best picture of a wart I could find without copyright restrictions. It's a plantar wart, which can be painful. There are about 10 different subtypes of wart based on their appearance and their predilection for certain areas of the body, but that is beyond the scope of the Step 1 exam. There are also roughly 200 different serotypes of the virus. We will discuss a few specific high-yield serotypes, but for the most part, this is also beyond the scope of Step 1. A large majority of the warts regress spontaneously over the course of weeks or months. The body is usually able to clear the virus without medical intervention. However, clearance of the virus does not necessarily confer immunity to future infection. If the wart causes an unwanted cosmetic appearance, it can be removed through a number of different techniques, including cryotherapy, freezing, and topical salicylic acid, an active metabolite of aspirin. In addition to causing warts in areas like the hands and feet, human papillomavirus is also an STD. It is actually the most common sexually transmitted infection worldwide, and is associated with genital warts and various types of genital cancer. Condyloma acuminata is a genital wart caused by HPV. HPV serotypes 6 and 11 are most often associated with genital warts, but rarely associated with genital cancers. However, patients can be infected by multiple serotypes at once, so the presence of warts does not rule out cancer. HPV is associated with cancers of the vagina, vulva, penis, and even the oropharynx. I'll leave it to your imagination to figure out how the virus gets there. However, your focus should be on cervical cancer, because it is by far the most common. There are about a dozen subtypes of human papillomavirus that are considered high risk for genital cancers, but serotypes 16 and 18 are discussed most often on the exams. While in most patients the virus is cleared relatively quickly, in some patients the virus can remain as an active subclinical or asymptomatic infection for many years. Over time, often over a decade, these persistent infections are the ones that can lead to cancer. Cancers arise as a result of the viral genome being integrated into the host's cell's DNA. In particular, genes coding for E6 and E7 oncogenes are carcinogenic. These viral proteins inactivate tumor suppressors, leading to unregulated cell division. In particular, E6 inactivates P53 and E7 inactivates RB. Since it takes many years for the viral infection to turn into cancer, and early interventions improve outcomes, papillomavirus is an excellent target for screening. A PAP Smear, aka PAP test, is a screening test used to look at cells of the cervix in hope of identifying precancers and cancers before they can become malignant. Using a small brush, cells of the transitional zone are removed so they can be examined under a microscope. The transitional zone is where the outer squamous cells transition into the inner glandular columnar cells. This is the most common location of cervical cancer and represents an area of physiologic metaplasia. Koilocytes, aka koilocytic atypia, are irregular squamous epithelial cells seen on PAP smears that can signify HPV infection. These cells have an enlarged, darkened nucleus, perinuclear clearing/halo, and an irregular border. Here on the left, you can see normal cervical cells, and on the right, you can see koilocytes. A PAP smear may be combined with an HPV DNA test, which can help identify specific high-risk subtypes of the virus, and if negative, may allow you to decrease the frequency of PAP smears. There's currently a debate about the best frequency of PAP smears as well as the age they should be started and discontinued. Therefore, you will see different numbers depending on what guidelines you're looking at. The United States Preventative Service Task Force recommends PAPs every 3 years from age 21 to 65, or every 5 years after age 30 if the PAP smear is combined with a negative DNA test. Interpreting the results of the PAP and determining the follow-up testing and/or treatment follows some pretty complicated algorithms and is therefore largely beyond the scope of step 1. You just need to know the basics. If the results are normal or negative, the patient just needs the normal PAP smear follow-up in a few years. If the results are inconclusive, such as atypical squamous cells of undetermined significance, or ASCUS, the patient will need closer follow-up with repeat testing. Clearly atypical results, such as low-grade squamous intraepithelial lesions, LSIL, or high-grade squamous intraepithelial lesions, HSIL, will likely require additional testing such as colposcopy or biopsy. There are now vaccines that protect against some of the most common strains of HPV. These recombinant vaccines, which go by trade names like Gardasil, help prevent against certain serotypes of the virus, such as 16 and 18. These vaccines are only effective before individuals are exposed to the virus, and therefore are recommended primarily for teenagers. These vaccines are particularly important in females, but are also recommended for males in order to reduce their risk of transmitting HPV to partners, as well as decreasing their risk for genital warts and penile cancer. PAP smears are still required for females even after receiving the vaccine, as it does not prevent all serotypes of HPV. Parvovirus B19 is a non-enveloped, naked, single-stranded DNA virus that infects the red blood cell precursors in the bone marrow. The most common presentation of Parvovirus B19 is Erythema infectosum, or Fifth's disease, in school-aged children. This is when a child has a slapped cheek red rash on their cheeks that later spreads to the trunk and upper extremities. There can be a prodromal period of fever, fatigue, and upper respiratory symptoms lasting for a few days before the appearance of the rash. It was originally named Fifth's disease because at the time it was the 5th most common cause of red rash in children. We got a couple pictures of red rash here. This little guy on the left has the slapped cheek rash and doesn't seem to be having a very good day. But on the right, we have a toddler who is just loving life. He is displaying a pose we refer to in medicine as straight chillin', and that position is pathognomonic for parvovirus. Super high yield. Anyway, well, I consider making him my website's official mascot. I think I should probably move on. You can see his rash has spread to his arms and trunk. Adults do not get Fifth's disease, but they can present with joint pain, often with a history of exposure to a child with Fifth's disease. Healthy adults may also have a mild temporary anemia due to parvovirus, but this is usually subclinical because healthy individuals have a reserve of red blood cells. Individuals with hematologic comorbidities are at particular high risk for anemia because their erythropoiesis, production of red blood cells, is already being stressed. For example, individuals with sickle cell disease or hereditary spherocytosis are dependent on a near constant production of red blood cells due to a high rate of RBC destruction. These individuals cannot handle even a few days of decreased RBC production. This scenario of profound anemia is often referred to as aplastic crisis, aka reticulocytopenia. Parvovirus can cross the placenta and is one of the torch infections. It is O for other. I'm going to hold off on talking about that until a later video dedicated entirely to torch infections. Adenovirus is a non-enveloped, naked, double-stranded DNA virus that is primarily spread via respiratory droplets. It is mostly seen in children, but also occasionally in adults. It is usually seen with children in close contact with many other kids, like at a daycare or camp. Historically, severe infections were seen in the military, often during basic training. The U.S. military used an Adenovirus vaccine in the past, but it has since been discontinued. Adenovirus primarily presents as pharyngoconjunctivitis. This can include pharyngitis, sore throat, conjunctivitis, inflamed eyes, fever, and lymphadenopathy. Adenovirus can cause the clinical picture commonly referred to as the common cold. However, there are many other viruses that cause this clinical picture. It should come as no surprise that adenovirus got its name when it was originally identified in the adenoids, or tonsils. While adenovirus most often causes a mild, self-limited infection, it can also cause more serious respiratory infections or serious infections of other organ systems, especially in the immunocompromised. That brings us to the end of the video. I'd like to send a big thanks to Christina Yosef and Brantley Judah for going to stomponstep1.com and making a donation that helped bring this video to you all. If you found this video useful, please subscribe, as it will make it easier for you to find my videos in the future, and it helps me out a lot. You can click on this orange box here if you're watching on a computer. If you'd like to be taken directly to the next video, you can click on this black box here. The next video is going to cover all of the RNA viruses I haven't gotten to yet. So rotavirus, rabies, measles, mumps, et al. Thank you so much for watching, and good luck with the rest of your studying.